humbly request us to get started and take this opportunity to invite our dear chairperson for Charter for Change Working Group Uganda for honoring us and accepting us to organize this learning event. We thank you for that and invite you to welcome all of us and set us rolling. Over to you, Chairperson.
Please join me to welcome Apollo on the floor. Thank you, Apollo, for joining, and thank you for standing with Charter for Change Working Group.
Thank you. Thank you very much, Joyce, the chair of the Charter for Change Uganda fraternity. Your leadership, I'm sure you have John Dark, your deputy there. I know Naomi is there, the secretariat lead, and your entire governing group. I am humbled, Joyce, for your comments on the work we've done with CARE on localizing development and humanitarian work. Let me also thank you as a Uganda chapter for Charter for Change for staying at this journey of localizing the work we are all paid to do, development and humanitarian. Anyone who pretends that this is an easy thing would be telling lies. Leaders like you are dealing with incredible challenges every day. So to stand here and convene us and speak about a subject as critical as SCHR, or safeguarding as we call it, deserves a big recognition and thank you. I am excited, Joyce, actually, that you people are talking safeguarding, because safeguarding is for the big and small. I'm sure you've seen over the years, extremely big, viable entities almost brought down for not paying the right attention to matters safeguarding in their work. So when I see Charter for Change fraternity already fronting this as an area of work and inviting an expert like you have from Geneva to start deepening competencies in this area, I can only say a brilliant job, and is evidence of the takeoff that is happening with the fraternity you lead, Joyce, and your team in Uganda. I want to quickly move on to my reflection, my OD, Organizational Development Reflection, about safeguarding, and in this case, by the Charter for Change in Uganda. One, I think you're dealing with this, it's already on the table, and I've thanked you for that, and you take credit for just sitting back and saying, let's discuss, let's capacitate ourselves on safeguarding matters. The second aspect, Joyce and team, that you then have to think about is how do you sustain it? When you get this, when you capacity shares, we say, with whoever individual agencies you're going to capacity share with, ask yourself as a leadership team how the fraternity, how the people that are under you are going to sustain this. I can tell you that it's one thing knowing the elements of safeguarding, it's another thing having a mechanism to sustain it. So as the presentation happens this morning, as a leadership team, when you've gone away, ask yourselves that having got what we've gotten, how are we going to sustain it? And Joyce, as you know, if this is something that we can add value to as the Charter for Change signatories, given the partnership that is already there between us and the steering group, it's a conversation that we would welcome. The third aspect, once you've dealt with the first one, which is the what, and you're doing now, you've done the sustenance, which is the second one, is how do you get deep? How do you deepen competencies or skills in the safeguarding field? How do you start to get expert agencies from the fraternity of Charter for Change? And in my opinion, it's the third level that you should aim to get at. That with time, you will not even have to go to Geneva to invite someone to capacity share on safeguarding, that it should be done in country. That will take some planning, that will take defining a roadmap, a pathway, and that will take resourcing. And let me challenge you, Joyce, and the leadership team. Put it on paper. Let's discuss it. Let's talk through how you go 1, 2, sustenance, and 3, deepening. So we have a critical team of national players, national individuals, national staff that can manage the full cycle of safeguarding. If, for me, anything less than that would be not doing full justice to the good work you're already thinking about. You don't need care. You don't need big players to do this in time. It should be done in-house. It's the challenge that I came with here to say thank you for starting on it. Thank you for addressing the what. Thank you in advance for looking at how you sustain that. And thank you in advance, Joyce, again, for looking at how you start to deepen and develop expertise around that. Networks like C4C, in my humble opinion, need to explore ways to add signature value to the local civil society landscape in this country, to the big civil society landscape in Uganda, in the region, Great Lakes, and outside, and to remain relevant. Organizing us, calling us to meetings like this is one important work you do. But what will ultimately sustain you is starting to identify areas where you bring signature value. And this is a potential area for that if it is done right. People would be thinking, why would I be saying this? Because I want CARE to and others to keep doing this. No, to the contrary, as you said, Joyce, I am a big supporter for me as an individual of the work we do going to national agencies, but it will only go when certain things have happened. And excited again that your leadership is already on the ball here. In conclusion, Joyce and the team, I want to thank the facilitator, the resource you've brought on board for committing the time to do this with you. I also want to thank the fraternity, your wide membership in Uganda, for investing their time in doing this. But also say or request to Joyce that once this is done for you, remember to take this beyond C4C fraternity in Uganda to the other wider civil society networks. And I can give you an example. The women-led women rights organizations we are working with for us as CARE, and indeed other agencies like Oxfam, CRS, will benefit from this kind of thing. Some of them I know will be here, they are your members, but others are not. So start to explore, start to think around how you then take that beyond you, so you start benefiting the wider public for the wider good of Uganda and the development sector. Again, all the best. I look forward to learning how this goes when you do the after action review, and to knowing how we, as the steering group of the Charter for Change in Uganda and the signatories, can help backstop this. It's you to do it. I always say this, Joyce, you know, it's not us to do it. Ours is to accompany if you think we can do that and bring value to the table. Thank you very much, and the very best with this training.
Thank you so much for showing up, Apollo, and over to you, Matilda.
Thank you.
Thank you so much. Thank you for these very inspiring opening remarks. I'm going to introduce myself. My name is Matilde. I work for the CHS Alliance. We are a network based in Geneva, but with organizations everywhere in the world who, and our network really tries to work on everything that was just mentioned now on, making sure that we are accountable, and we really want to make safeguarding a priority. So we are a network of more than 150 organizations that we have everywhere, and that we want to continue expanding, of course. So I'm going to be here talking today about something a little bit specific on how we can harmonize the way we report incidents of sexual exploitation, abuse, and harassment. This is a global initiative, and the reason for it is that we know that safeguarding issues and sexual exploitation, abuse, and harassment happens in every single country of the world. There's no question on that. And now we're really at the stage where we understand that this is a problem, but we really want to understand the details of the problem. What are the permissive settings? What type of profiles do victims or survivors have? What are the profiles of the alleged perpetrators? Because if we understand these patterns, we know how to take action. We have evidence to say, this is the priority. This is what we need to work on to eradicate this from the aid sector. Incidents of sexual exploitation, abuse, and harassment are probably one of the worst things that can happen in the humanitarian sector. We are here to help, we are here to support, we're here to protect the communities that we serve. So obviously, if they are victims or survivors of sexual exploitation and abuse and harassment, we have failed that. So the project that I'm here to talk to you about today is really a way for us to harmonize the way we collect, report data on sexual exploitation and abuse, so that we can put that data together and really understand the problem. So I'm just going to share my screen with a presentation here so that you can also follow me visually. Oops, let me, sorry, I was at the last slide. Here I am. So as I said, the project I'm going to be talking to you about today is called the Harmonized Reporting Scheme on Sexual Exploitation, Abuse, and Harassment. And really where we are at in the aid sector today was that we don't have comparable SEAH data collected. Some organizations report some of it publicly, they do annual reports, but today we do not have aggregated data analysis. So a report that says, this is what sexual exploitation, abuse, and harassment looks like in the aid sector today. We know it's a problem, but we don't know the details. As I was saying before, we have some scandals that come out that were mentioned earlier. We have some things that come out, but we don't have a proactive way to say, we're going to try to understand the problem so that we know how to tackle it. And so the CHS Alliance, based on this realization, said, okay, let's do some consultations. Let's understand what is the data that organizations are collecting so that we can find a way to harmonize that in the way that's most easy for them. So what happened is that the CHS Alliance did an entire year of consultation with more than 80 actors. So there was, international NGOs, national NGOs, some in Uganda. There were UN agencies, private sector organization, and we asked them, what data are you currently collecting? And based on that, we created a template for organizations to report this anonymous data, and we tested it for another year with a lot of organizations, including a lot of national organizations, because as was very rightly said, you or international organization play a huge role in safeguarding, as you are the ones who are most present on the field. You're the ones who are most in contact with populations. And so we tested this framework for an entire year and we tweaked it, and now we are at scale up. So our objective after, now that we are scaling up, is to make sure that organizations collect the same set of data using this agreed framework so that we can have this analysis at the global level, at the country level, so that we understand what is happening when it comes to sexual exploitation and abuse, and we can have quality trends analysis so that it can tell us this is exactly what we need to focus on. These are the actions that we need to take to prevent and respond, because we believe that evidence-based action is the way for us to effectively and durably succeed in reducing risks, preventing, and responding. So the harmonized reporting scheme is a very simple system to collect and report anonymized and harmonized data on SEAH by organizations. So here we are not a community-based complaints mechanism. It's really the organizations, once they've done all of the process to manage the incident internally, who report into the system so that they contribute to this database of incidents. That allows us to do the trends analysis to better understand SEAH with trends, with patterns, and as I said before, informs risk mitigation, prevention, and response efforts. We think it's a key piece to enhance accountability towards affected populations and the transparency of organization. We are coming back from an era, the last decades, where what was happening whenever there was an incident was that organizations were just kind of trying to hide it. And, that it was the dirty little secret that every organization had, but that we tried to hide it. Now we know, because of the power dynamics in the aid sector, that these incidents happen. So we want to encourage transparency. And the donor who is backing this project, the UK government, really rightly said that, it's more of a problem if an organization does not have incidents, because it means that they have reporting systems that don't work, because we know that SEAH is a reality of the aid sector because of the power dynamics. So what they rightly said is that it's not so much that we have zero tolerance for SEAH, but we have zero tolerance for inaction. So it's okay for an organization to have and to report SEAH incidents. What is not okay is if an organization does not take action to these incidents, because we need to be realistic. SEAH happens in the sector, if we want it or not. So really, that's a key message that I want to convey today, and a key message that donors supporting this project want us to send down to the field, that, we don't want people hiding incidents. We prefer for them to be transparent and for them to take action. And then the last kind of objective of this harmonized reporting scheme is to make sure that we reduce underreporting. We know that what is being reported is only the tip of the iceberg. And so we think that by being more transparent, by showing affected communities what we are doing to respond to sexual exploitation, abuse, and harassment, that ultimately they will say, okay, something is being done, so I need to report. And by that, we will start seeing a bigger and a bigger tip of the iceberg, because an important reason why people are not reporting is that they think, nothing's going to happen. I'm just going to make things more complicated. And so if they see, okay, I can get access to assistance, that, perpetrators are being dismissed. If they see that, they're going to be more likely to report. So that's really why we came up with this project. What is expected from participants of the harmonized reporting scheme? It's really simple. You report non-identifiable data on SEAH incidents. So we really privilege and confidentiality is central to the project. So we don't collect any personal information. What we are doing is only to have trends. So your organization obviously manages the investigation and will have that identifiable information, but we never ask you to report that to us, because we want the data to stay anonymous. And we really look at aggregated trends, not specific incidents. How you report is very simple. We have an online platform as well as an offline version for organizations who may have issues with connectivity. And you just fill out a template, which is all drop downs. So it really takes you 2 minutes to report an incident. And you're really, if everybody takes 2 minutes of their time to report, the 5 incidents they had this year, then we know what's happening. So it's really, we really encourage you to spend those 2 minutes, report the incident, so that we create this database, and we really understand what's happening globally, but in Uganda specifically. And we ask organizations either to report on a rolling basis. So you take those 2 minutes whenever you have an incident, or at the very minimum, we ask you that you report all of the incidents every 6 months. This is the data. What you see on your screen is the data that we collect. So it's very top line information, because we want this to stay simple. We know that reporting burdens in the aid sector are already really high, and it's much more important the work that you are doing on the field than the work that we have to do behind the computers for reporting. So that's why we kept it as simple as possible. So we asked the country and the date of the incident, the type of allegation, so if it's exploitation, abuse, or harassment, and then we look at the reporting channel that was used so that we understand how are incidents coming in and how are they not coming in. So we see what works and what doesn't, as well as the profile of the person who reported the incident. We then look at the status of the allegation. Was it substantiated, unsubstantiated, inconclusive, and any remedial actions that organizations are taking, so that we can see also what works and what doesn't. So did you decide to do more training for your team or community awareness raising, etc. And then we have 2 optional data fields on challenges and lessons learned. So that's where your organization can share text on what are your challenges so that we can understand at the global level what are the challenges, and we can, do advocacy with donors. So for example, if we have multiple organizations telling us we don't have budget to conduct investigations, then we need to understand that, and we need to talk to donors and say, hey, we have a problem. We have incidents, but people don't have resources to take action. We can't expect them to take action if they don't have resources. Or it's a great way also to share lessons learned. If you have a good practice to share, we share it with other members, and you will benefit from learning, this worked in Iraq, this worked in Kenya. We can really learn from each other because we all try our best to respond and prevent SEAH, and there's a lot of good practices globally. So this really allows us to make this membership a community of practice. And then we collect basic information on the victim survivors, so their sex, their age group, if they are a staff member or community member, and the assistance that was rendered to them. We then look at information on the alleged perpetrator. So again, what was their sex, their status, if they were national or international staff, their profile, if they were senior manager, a middle manager, a staff working on the field level, a volunteer, a contractor, etc. The responsive action that was taken against them. So if, they were dismissed, if they received a warning. And here you can also say that no responsive action was possible because we know that that's the reality of SEAH incidents. They're really complex to tackle. And so if no responsive action was taken, we ask you why. And here it's really not because the CHS Alliance wants to do the police. No, we want, again, to understand the trends of why we're not able to take action, because that allows us to improve as a group. So really what I want to emphasize here is that our objective is not to be, policing organization and checking what you're doing, what you're not doing. We don't look at incidents individually. We put the incidents together without any mention of who reported what. So we create this this global and this country database without, again, identifiable information, and we understand what the situation is. It really gives us that snapshot to say, okay, this is what's working, this is what's not working, here is how we can improve. This is the advocacy that we need to make so that we can improve. So that's, again, investing a couple of minutes whenever you get an incident to report, and it really helps us understand the bigger picture to inform this action. This is what the reporting platform looks like. So you kind of have 3 sections to it. Obviously, there's a place where you report an incident. It really takes you a couple of seconds, all drop downs with the data that I just showed on my screen. You can review reported incidents. So if you want to add information, change information, you can always review them. Obviously, each organization has their organizational space. So if I'm organization A, when I click review reported incidents, I only see the incidents that I have reported. I never, ever see incidents of other organizations. And then you have access to real-time data analysis that looks like this. So what you can see on your screen is our trends page. And you can see at the top that you have trends for the geography of incidents, general information, so the type of incident, etc. Here you have an example of the reporting channels being used. You have trends on the survivor victims, on the alleged perpetrators, and on the responses taken. So you have access to these automatically generated graphs that, again, allow you to understand here, for example, what was the reporting channel that was used, or what was the profile of the person who reported, again, so I know what's working and what's not working. It was really interesting for us to see in our last report that, as you can see here on the street, community-based complaints mechanism were barely used, 10%. And we invest a lot in these community-based complaints mechanism, but they're not the main entry point. So it makes us question, how can we improve them? And then you can see here that you can always filter with the little white boxes. You can look at incidents specifically for your country. So I want to look at information specifically for Uganda. I can do that. And the really great thing is that you can see the trends only for the incidents of your organization. So if I want to see what's happening for the incidents that I reported, I can see that. And I can also see aggregated trends. So across all of the members of the harmonized reporting scheme, we create these graphs. Again, no way to identify who reported what, but it's a great way for you to benchmark, to say, well, community complaints mechanisms are not working for me. What's working at the country level? What's working at the global level? Again, to talk about, to contribute to this learning. And there was a lot said about learning in the opening remarks, and it's a learning event today. And what we want to emphasize is that you can learn so much from the data, right? Because we didn't have data, we've been kind of guessing on our work for SEAH. We said, oh, maybe we should do more trainings. Maybe we should do more awareness raising, but we don't really know what's working and what's not. And this is a way to say, this is what's working at in our organization or in our country, etc. So this is really all dynamic. It all updates automatically. So you don't need to do anything except look at the graph and use them if you want to look at a specific date, if you want to look at, incidents only for minors, if you want to look at incidents only in Uganda, incidents from my organization, incidents from all organizations. You can really use this to understand what are the patterns when it comes to SEAH at your country or organizational level. So here are other examples of, this is the trends for survivors' sex and age, their survivor status. Here you have examples on the trends with regards to the sex of the perpetrator, their status, if they're national or international, their profile, what is the proportion of senior managers, middle managers, volunteers, etc. Here is another example of responsive actions. And here you can see, for example, that we're seeing that there's a lot of incidents where no responsive action is possible. And it's really useful to understand why we can't take action so that we say, okay, well, maybe we need to do more training. And I'm going to give you an example here. One of the things that we saw was that no responsive action was taken because organizations didn't have sufficient information to assess the allegation. We didn't have enough information to do an investigation. And so we said, okay, well, we need to develop more trainings for frontline staff because we saw that they were the one receiving allegations, and maybe they weren't equipped to collect the correct information so that an investigation could take place. And then we're not able to reconnect with the survivor, and then this incident is just never taken care of. So that's how, the power of data to tell us this is where, the link as part of the whole response to SEAH, this is where we have a problem, and this is how, we need to address it. So these are just incidents, examples of how you can use these trends. Obviously, as I said many times, identify priority areas on SEAH. So where do I need to focus my efforts? Because we know that the resources are limited. In terms of transparency, it allows your organization in a click to produce your annual reports on SEAH. It's a lot of donors now require organizations to have these annual reports to be transparent about what's happening when it comes to SEAH and how they're responding. So again, in a click, you can produce those reports. It allows you to request resources to your donors for evidence-based issues. So if you see, for example, as I said before, one of the conclusions from the data is that frontline staff is not equipped to receive disclosures of SEAH, then you have data to tell your donor, look, this is the problem. I need resources to develop training materials from my frontline staff, or I need resources to organize trainings. Having this evidence really helps you convince. And then finally, as I said before, you can compare, you can learn from others. You can say, this doesn't seem to work in my organization, but I'm seeing it's working in another organization. So you can really use the trends to compare and learn from other organizations. So quickly, what's the added value for you to join and why we're here today to encourage you to join? Simplified SEAH reporting. We are working with all major donors to make sure that they align to the harmonized reporting scheme. So you don't have to spend so much time filling out this form for this donor, this form for this other donor, etc. We give you access to analytical reports with recommendations and resources. So us as the CHS Alliance, we create these reports so that you can have access to trends and recommendations with resources. So we really analyze it for you, and we help you have access to resources to implement the recommendations based on the data. And then, as you just saw in the previous slides, you have access to those dynamic graphs that can be tailored to your organization or to your context. And then, just as you're here today, we organize a lot of peer-to-peer learning and capacity building events for all of the HRS members. So when we see a trend come out in the data, we say, okay, let's get together. Let's either do a training, or if it's not so much of, sometimes it's not so much of a training that we need, it's just putting our brains together and brainstorming and saying, okay, we're seeing this in the data. Why is this a problem? How can we address it? And we really work with an organization in Uganda, one in Canada, one in Geneva, one in Bangladesh. And we really bring our different expertise, our different contextual knowledge to find solutions. And then, as I said many times as well in the beginning, this is ultimately a marker of accountability and transparency. So your organization being part of the harmonized reporting scheme, and we will feature you as a member, of course, on our website, is a way to say, my organization wants to be accountable and transparent when it comes to SEAH. Prerequisite to participate, there is only one, that your organization is able to collect and report incidents on SEAH. That's it. Once that condition is filled, participation is completely free. And it's open to all type of organization, whatever the size, whatever the country, there's no limit. Any organization can join. And to join, it's very simple. You contact us to express your interest. You sign a data sharing agreement with the CHS Alliance that outlines, it's a 2-page document, very simple, explaining issues around confidentiality and how we safeguard the data. And then you will receive an induction and logins credentials to the platform, and you can start reporting. So it's a very simple process. You have to contact us at the email that you see here in yellow, and we'll be happy to take you through the process. That's it from my side. I hope the overview of the project was clear. We really encourage you to join because, again, the more organizations we have in Uganda, the more interesting the data becomes for Uganda. And we have already discussed as well with the PSEA network. The idea is really that it's a couple of minutes of your time to report. You have access to learning events, to obviously our platform and all of the data analysis that is done for you. And the great kind of outcome of this is that we know what's happening on SEAH in Uganda. And as a group, we can take action to make sure that we have less incidents that are coming up. So I'll open the floor to any questions that you may have, any needs for clarification. I'll stop sharing my screen because I was not seeing the chat. But please feel free to raise your hand. I'm really happy to answer any kind of questions that you may have.
Thank you, Matilda. One of the questions is a comment probably from Thembo Israel. Kindly share your presentation. We shall do that. We'll be in touch with Matilda. And then colleagues, please, if you have questions, we only have about 10 minutes. Raise it straight to Matilda since we have her here.
Naomi, I have shared my questions on the chat. Yeah, thank you. I hope she can also see them.
Yes, I can answer them orally. So what are the key safeguarding risks that organizations face in humanitarian settings? For this, as I share my presentation, I'll share our last analytical report where you can see a lot of the risks outlined, because obviously there are many and I'm not going to have the time to go through all of them. And again, in that report, it's going to answer a lot of your questions on, examples of effective safeguarding policies. We have a lot of that in the report directly. And then how can humanitarian organizations ensure their safeguarding measures are culturally appropriate? That's, I think, where the harmonized reporting scheme, that's also our objective, to make sure that the data that we have on SEAH and on safeguarding is contextual, right? So that you understand what are the risks in Uganda, because they may be very different than what are the risks in Iraq or, again, in Colombia or in Bangladesh. We want you to have that contextual information so that you can take contextually and culturally appropriate actions that are relevant to your context. And then there's a couple of other questions. that are a little bit outside of the scope of our projects of, what is the role of communities. Again, we can connect you. We work very closely with the Resource and Safeguarding Hub that has a lot of resources that kind of answer to your questions. So I encourage you to contact me directly so that I can answer a lot of these questions in more details, because we have little time. And I'll leave the floor to any other questions that there may be. And I'll share now in the chat the email that you were
Thanks,
asking.
Matilda.
Thank you very much.
Awesome.
Um,
I think no more questions here. I don't see any.
I see a raised hand.
We only have. Okay, go ahead. Teopista, please go ahead. That's a women rights activist. Go ahead, Teopista. You're muted. We can't hear you. Teopista, you're muted. We can't hear you.
Maybe you can send your question per email. I just shared our email in the chat, and we'll be really happy to answer.
Okay. And then anyone else who wants to communicate directly to Matilda, please. Matilda, I think you've shared your email, right?
Yeah, I just shared the email in the chat, and then I will share, Naomi, with you the presentation I just made so that you can circulate it with the group.
Then there's one question here from Ongatai, our Eastern Region representative. How do you treat sexual harassment? Is it basically targeting male or female collectives? How do you handle issues of HIV, STIs in terms of who was on the wrong? Yeah, Matilda, quickly for you.
Yeah, again, to answer like these very specific questions, I really encourage you to read our analytical report, because there's a lot of information there on recommendations on how organizations can respond to sexual harassment. Obviously, again, it's really contextual. So I really encourage you, what we want to do as the HRS is to provide you with the trends, and then, you as local actors in Uganda know so much more than me and our colleagues based in Geneva. So we provide you the trends, and then we really encourage you to interpret them, contextualize them, see how you can use it in your local context. So we provide you the trends, and then we encourage you to get together as a group and say, okay, this is what's happening in Uganda. What do we do about it? So we really encourage you to take the discussion further at the local level to contextualize those.
Thank you, Matilda. And you have the email, so feel free to write to Matilda directly, but also she has shared how we can join online on how to collectively share information, evidence that is needed for effective way of reducing the risk to SEAH and reporting SEAH. I don't want us to close without a word from the manager. Colin, thank you for joining us.
With pleasure, although I didn't do anything. But nice to meet you all virtually and very happy to be here.
Thank you. And then we only have 4 minutes to go, and I would like to invite Mr. Mugisha Richard to close this learning event. Mugisha, you're muted in case you're talking.
Thank you very much, Naomi, and everyone who has managed to participate. Thank you very much, our facilitator today, Matilda. I think I'm right with that spelling, for such an insightful training and presentation. I think for me, this is a good opportunity for us as Charter for Change endorsers in Uganda, because this tool simplifies the reporting system, and it gives us an opportunity to learn from each other, and more especially keeping the confidentiality. And I'm sure now everyone who participated is well equipped to make an informed decision in order to express and subscribe to become the members on how they can improve the reporting system on SEAH. So really, it gives us an opportunity to diversify in terms of reporting systems. So thank you very much for such an opportunity and the collaboration. And I look forward to a continued kind of learning from each other. Thank you very much. And a very good morning to you all.
Thank you, Makisha, and thank you, Matilda.
Thank you.
We are right in time, and we are sure we're going to continue connecting with you so that we deepen our competency and skills in SEAH, but also contribute towards giving you the evidence that you need for us to collectively have an effective way to reducing risk to SEAH, but also utilizing the standardized approach to reporting SEAH.
Thank you all very much for your time. We really look forward to hear from you by email.